project or whatever? Did they keep any statistics?
Yeah, they had, well, the only data they had was people's self-reported feeling that it went well and that they liked it, which was very positive.
Oh, so I can truly value like the idea of a parent actually giving that narrative to the child. But as we know, many times in the field, by the time the child is actually cognitively able or emotionally able to understand what's happening, the parent is not even any longer in contact with that child. So in those situations, do you think it would be recommended for the people who are in contact with the child to provide the child?
I think there needs to be some explanation given, but I think it's 100% better if it comes from the parent. And see, here's my point, that most of these kids are having visits with their parents. And they're told, the parents are told, don't discuss these issues with the kid. So it's like the elephant in the room, right? The very thing that the kids want to know about, they're not able to have a discussion about. And I understand why the parents get that instruction, because you're concerned that they're going to say the wrong thing. So the issue is how to work with the parents to help them say the appropriate thing, right? And monitor it so that they do.
It's not always the case. I mean, you have some parents who don't want to accept the fact why the children were removed.
I know.
So honestly, like we just had a case last week, 2 teenagers, one of them sexually abused. The way I posed it to them was, you know why we're here. And that's the way I broke it down too. She had no idea. Although something happened, they had no idea why the diapers removed them.
They knew that there was sexual abuse, but
Correct.
they didn't know that was the reason for the diapers removal.
Correct. All they know was the reason why the father has to get out of the house. Because their concern was, why is dad going to jail?
Right. So, but they know they were the ones who told about the abuse in some way, right? They made a statement to somebody, but yeah. So, yeah, I agree with you that there are going to be absolutely going to be times when the parents are not going to say it. And I'm not saying that works for every case. I'm just saying that I think part of our job in terms of trauma-informed care is to try to help parents. This is for the kid, not the parents. To try to help the parent deliver some kind of an explanation that the kid can live with while they're in this state of we don't know which way this is going to go. If they can't, they can't. Yeah.
I just want to say that we're also trying to make better use of our therapeutic education programs early on in the life of the case to address exactly that.
Yes.
Because it does bring some type of, I don't want to call it closure, but it does bring some type of healing, for lack of a better word, to that child and helping them move along a little bit better in the system.
Absolutely. Unfortunately, we don't have the resources, apparently, to have most people in therapeutic visitation.
Yeah.
That's huge. Right. I'm sorry. Another? Okay. So, it's already 9:30. What time am I supposed to stop? 15 minutes old? Okay. So, now, that was the first category, was the attachment safety. The second thing has to do with this emotional management, helping families help kids, or helping caretakers help kids with emotional management. And this involves affect identification, affect modulation, and affect expression. And we already touched this a little bit. But basically what we're talking about, these next few slides, which I'm going to flip through quickly, really talk about we were talking about in several different places, which is that these kids' emotion is overwhelming for them, and it overwhelms their functioning, okay? And that lots of things remind them of their traumas and trigger these reactions. So, in helping kids to engage in affect identification, we're simply helping them to name the emotional states. I had said to you before, you can inquire. But a lot of times they don't even have the language for it, okay? So one of the things we try to do is support kids in developing a vocabulary to describe their feelings, to describe the level of distress that they're having. Are you angry? Are you hurt? Are you disappointed? Are you jealous? But they often don't have those words. The words are not there. They are, for many of these kids, mad encapsulates everything. They're mad about everything, but it really isn't all the same. There's jealousy, there's disappointment, there's a whole range of subtleties. If you're going to talk about feelings and talk about what triggers feelings, you have to learn a vocabulary. And if you have been somebody who's been traumatized and left alone to deal with your feelings, nobody's ever helped give you those kind of words. So we're talking about supporting children in building a feelings vocabulary, both for positive and negative feelings, helping them understand feelings as connected to the body. Bodily sensations are what feelings are about. Where do you feel anger? Where do you feel fear? Where do you feel joy? Where in your body do you feel that? So you become aware of the emotional content and the feeling content. Helping kids build connections between feelings and the events outside that may trigger it, as well as thoughts that may trigger those feelings. Helping children identify feelings in others. Now, we were talking before about distorted perceptions. I think she's angry at me. Well, no, maybe she's really not angry. Maybe she's sad. Maybe she's irritated at something else and you're seeing it in her face. I mean, so helping kids identify and look for reality testing around that. And then normalizing mixed feelings. This is a biggie, okay? We often have mixed feelings. We're often feeling positively about somebody and also angry at them. We're often feeling proud but guilty. I mean, there's often a lot of feelings that we have simultaneously. That's even more confusing for kids like this. So we want to help kids understand more about feelings, and that takes, again, everybody, because you want to catch it in the moment, right? What is the feeling right now? Now, you don't have to ask them. You have to say, I'm wondering whether you're feeling jealous right now. Now, I wouldn't start, this wouldn't be my first intervention with a kid, but it's just an example, right? It seems to me like somebody might feel jealous in this situation because somebody, you know, of course the kid was able to do something that you couldn't do. All right? Okay, modulation is helping kids then be able to handle the feeling, okay? Feeling gets aroused, recognize whether they're having difficulty, and develop modulation techniques. On the spot and in daily routines. These kids need to learn how to calm themselves. Now, I'm willing to bet that if those of you who do not have road rage, and I'm not going to ask people who have road rage to raise their hands, but those of you who don't have a problem with road rage, seriously, what do you do when somebody cuts you off to get rid of it? So you say something to yourself. I'm never going to see them again. Who cares about them? Okay, so you say something. What else do people do?
Glad I'm not them.
Glad I'm not them. Boy, they must be one heck of a place.
You learn from experience. You learn from experience, other people's experience.
So what do you do in the moment when you're sitting there and the person cuts you off?
Be patient and pray for the guy.
Pray. Honestly. No, seriously. That is a form of self-calming that many people engage in.
Sometimes it's not intentional. Sometimes they go, oh, maybe, you do it by, maybe something happens that you do it, maybe something happens to that person that they, cut you off.
Right. Exactly. A lot of thoughts. I just want to mention something like turning on the radio. Because people do things to distract themselves. That's another way people have of calming themselves. Let me think about something else. Let me get, just move past this. I'm saying this because you may not know where you got these techniques from, but somebody along the way helped you develop them. All right, and nobody helped these kids develop that. So that's what we're talking about, is actually teaching calming techniques and then practicing them. And you can't teach it in the moment. You can remind somebody about it in the moment, but you can't teach it when they're distressed. It has to be taught when they're not distressed, and then they need to be coached to use it when they are distressed.